spread and expand. It is doubling its numbers every 1 to 2 days. Currently in Oklahoma, we have 29 confirmed cases. We have more than 100 that are being evaluated at this time. And we have, for the first time, one child, less than a year old, who is positive for COVID-19.
What do we do? I mean, we keep hearing folks saying, I need a test. And the bottom line is we're hearing that the tests are not necessarily available and that we're putting a priority on taking care of our first responders, testing them, healthcare workers, those who are immune compromised, who are getting cancer treatment, HIV patients. So, Larry, what do we do? I'm hearing basically the bottom line is you need to take care of yourself at home.
Well, that's basically the truth. After a discussion with the Department of Health earlier today, after today's runs, the State Department of Health will have less than 50 test kits available. They're holding those back for emergencies. At the present time, private labs in the form of Quest, LabCorp, and DLO can do tests, but the way it's being done is that you would go to your private doctor's office. He would have to have the proper swabs and media, and then he can call the labs, and they will come pick them up, or they mail them to him with a turnaround anywhere from 2 days up to 7 days, depending on which lab you use. So at this point, people who want to be tested can only really be tested at private labs. There will be a charge, and what we've been told is $190 to $200. Obviously, the CDC came out with information that they want all tests to be free, but that needs to be worked out at this point. The labs have not agreed with that completely. So when we talk about testing, it is limited still in this state because the federal government is just not keeping up. We don't have the kits and we don't have the reagents, which is even more important. So until the federal supply line improves and gets the state the kits it needs and the reagents to run tests, we're going to be in limited supply. We want to eventually have drive-through testing, and we want to eventually have everybody tested. We won't know what the denominator is on this disease until everybody has been tested. Just testing those that are at high risk doesn't really tell us anything. As far as what people can do, it's what's been said all along. Stay home. That's the most important words we can hear today. I know people don't like it, but wash your hands, soap and water for 20 seconds, or using an alcohol, greater than 60% alcohol solution is effective, in doing it every hour to 2 hours, multiple times a day. That's number one. Number two, don't touch your face, your eyes, your nose. Those are vectors by which we can reinfect ourselves. Stay away from crowds. The CDC came out with the recommendation of no crowd greater than 10, and we need to follow that. I know I'm a gastroenterologist at the specialist. We have today. No elective endoscopy will be done for the next 2 weeks until we see what is going on. Hospitals.
Tell Dr. Yaz I said hello, by the way.
Okay, I will tell Dr. Raz you say hello. The hospitals are following course. No elective surgery is to be done. We're trying to keep the social distancing of 6 feet. All of that is important. Later today, we're going to be urging him to close all restaurants and bars. The mayors of Oklahoma City, Tulsa, and Norman have already declared that. We need to make it statewide. I understand the economic impact, but this is a case where we have to get ahead of the virus to be able to keep people at home, out of crowds where transmission can take place.
All right. So at this point, we're still just trying to figure out where we're going with this, and the test kits are the essential part of that. And until we get more test kits, we really just need to stay home, monitor our fevers, and when should we get? I hear 72 hours supposedly is a time frame that we might really get concerned about it if that fever remains high.
Certainly, if you have fever greater than 100.4, if you have a cough, chest congestion, shortness of breath, those are all factors, that symptoms that would be compatible with COVID-19. If you've had a travel history to go along with that, absolutely you're at high risk. You need to call your doctor, not go to the office, but call your physician, ask what you should do. Do they have any of the kits? Do they have the ability to do the swab and send it to the state health department? They are holding back the kits that they have at the state health department for those exact patients. But it needs to be people who are sick. If you have mild symptoms, flu-like symptoms, cold-like symptoms, you don't all need to be tested at this time. Yes, eventually we'd love to test everybody, but we don't have the ability. So if you have mild symptoms, isolate yourself, try to use good hand washing, stay away from the rest of the family, and once the fever is down for 48 hours, then certainly you can go back out. Usually that's going to be 1 to 2 weeks, and it is possible, even after fever has broken, that you can still be shedding virus and be infective to others. Dr. Fauci at the NIH has suggested, if we have the tests, that before people go out into public, they should have 2 negative viral tests done, separated by 24 hours.
Well, that is a lot of information. And still avoid the emergency room, because I hear that they're still being flooded with people coming in.
That's absolutely essential. People need to understand, while this is the major topic around the country and around the world, we still have people with heart attacks, with other causes of severe illness, and they need to be seen in the emergency room. The people with COVID-19, there is nothing the emergency room can do. If the patient is severely ill with severe shortness of breath and needs to be hospitalized, that's one thing. But if it's the person who can drive themselves to the emergency room because they're running a fever or they have a cough, no, stay home, call your doctor. Don't go to his office, and absolutely try to avoid the emergency room and leave that for the critically ill patient.
Dr. Larry Bookman, president of the Oklahoma State Medical Association. Hopefully we can talk to you next week a little bit more about this. Thanks for your time.
You give me a call anytime. We're happy to spread the word, so to speak.
Got it. Thanks, Dr. Bookman.
Thank you.
Bye-bye.
The amazing team at My Pillow is great.
Is that okay? Now, I won't use these for Fox.